Hello and welcome to Sinai Dental. Happy New Year, and may your 2021 be a year of great blessing. My name is Dr. C.A.Botchway. Shalom. As a general dentist, I believe it is very important to keep our patients updated with information and educational tips. Today, I wanted to do a short informational video, long overdue, I know, about some of the things that we have implemented to ensure that your visit to our small clinic remains relaxed and stress-free. So let's go. Every patient is carefully screened. To attend our clinic, you must fill out a mandatory COVID screening form, as well as our Sinai protocol form, to make sure that we are on the same page. For instance, with our protocol form, we now have patients wait in their cars until they are texted to come in. So we have eliminated patients in our waiting room. It's important to know this and to text when you arrive. The COVID form indicates that you have no symptoms of COVID, nor have you engaged in any activities that could have exposed you to COVID, and these must be filled out and digitally submitted to us before your appointment. Every patient attending our clinic must be wearing a mask when they arrive and have their temperatures taken and use hand sanitizer at the door before they enter the clinic. When patients arrive, they leave their coats, their bags, and their phones in the waiting room, whose chairs, coat racks are sanitized between each and every patient. Our doors are secured during treatment, and there is zero traffic through our waiting room until the patient is dismissed. On entry to the operatory, patients wash their hands and don't retouch their masks until the procedures are completed and they're putting their masks back on, ready to exit. All our patients have a hydrogen peroxide mouthwash and wear protective goggles before the treatment begins. All appropriate procedures are done under rubber dam to protect the airway, of course, as well as to further cordon off any kind of droplet. So for cleanings and other procedures, all aerosol producing equipment that we used in the past are replaced with manual hand instruments. This is of course a little bit harder on the operator, the dentist, or the hygienist, but it is safer for all. But although not aerosol producing, all work is still conducted under the air dome. The air dome was made in a device that was made in British Columbia, Canada, and details of the air dome are on our site. This device has been in our office since July of 2020. Now, in addition to the air dome, the air cleansing air dome, which is on for all patient procedures, we also have the air vaccine device. It's an air cleansing device which is on during the entire clinic day, and if required is left on overnight as well. As you know, we are a part-time clinic, and only one aerosol procedure per day is done in our clinic, that is fillings, and it is scheduled always at the end of the day. This procedure is always conducted under the dome, as is all treatments, and the dome reduces aerosols to zero, and on completion the air systems run. The clinic is vacated for almost 18 hours, i.e. the next day. No patients are ever booked in Sinai Dental directly after an aerosol procedure. So if you've been wondering why it takes so long to get in for a filling, this is the reason why. Now, there have been some questions as to whether the dome is a little claustrophobic, and I can tell you that the dome is see-through. It's barely noticeable. A lot of my phobic patients love it. There is only one drawback that I can really think about, and it's not the dome. It's just the sound. It's a little bit noisy, and you cannot really hear me talk too clearly, which might be a blessing to some because you don't have to listen to my stories as I work. But I can't really talk to you too much as we work. So that's probably the sound that is perhaps a little bit loud. Other than that, it is a wonderful dome to be under, and many people feel extremely comfortable you can take a look in the video and see what you think. Immediately after their treatment, patients place their mask back up on, come out of the dome, they wash their hands, they pay their bills, and they leave the clinic. We try to make sure that forms and receipts are sent digitally, and lingering in the waiting room is discouraged. Some patients have asked, well, what if I need to go out in the middle of treatment, if I need to go to the washroom? Well, if perchance a patient has to take a break in the middle of treatment, of course, you can use the washroom, which is down the corridor, but we do have to go through the whole procedures all over again. So we do advise, please, as much as possible, try to use the washroom before you come in, and if you need to use it, not a problem, that's okay. We'll just go through the procedures all over again. Well, I hope this video was helpful to you. I hope that I communicated clearly and answered as many questions and clarified as many things as you had asked, and if there's any questions that you still have unanswered, please don't hesitate to reach out. Clarification is great, communication is even better. So, if you have any questions, if you need information on relaxation tips, like our pre-clinic breathing exercises that a lot of orthopic patients do, just reach out. If you're unable to find anything on our website, and you should be able to if you look carefully, but if you can't, don't worry, don't stress about it, it's not worth it. Just reach out and ask us, and we will try as much as possible to provide that. So okay, we will see you soon, and be safe. Shalom. We'll see you again.